Hello all, myself Jaison Varghese from Electronics and Communication, HVCE. Today I am here to present my technical seminar paper on a new approach for secure cloud-based electronic health record and its experimental testbed. I am doing this under the guidance of Professor Swapna CH, Electronics and Communication Department. Now further moving on, the contents of the presentation are introduction, literature survey, objectives, methodology, result, applications, conclusion, and reference. The introduction and EHR, that is electronic health record, can contain important personal information such as name, address, phone number, birth date, and social security number. It also holds vital medical information about a person like diagnosis, treatment history, lab results, and prescriptions. The advent of Internet of Things technology and the development of medical internet-based applications and devices, we have witnessed a remarkable progress over the last 2 decades. Electronic health records are increasingly being used in healthcare to provide patient care and reduce cost. However, the adoption of EHR also raises concerns about the security and privacy of patient information stored in cloud. The widespread use of cloud computing technology for a broad range of applications is another key factor that has attributed to the fast growth of EHR in the last healthcare industry. The proposed anonymization algorithm is to obscure the patient's cardiac information during transmission and to protect information stored in the cloud database. The cloud computing paradigm offers tremendous change to the way EHRs are implemented. It also possesses particular security and privacy threat. This new approaches uses a combination of cryptographic technique and access control mechanism to protect confidentiality and integrity of patient data stored in the cloud. These are the literature surveys I have done for the paper. Moving on to objectives, the objectives are to develop secure architecture for cloud-based CHR that ensures confidentiality, integrity, and availability of patient data. Next, to develop a scalable and efficient system that can handle large volumes of patient data and user requests and to minimize latency and response time. Next objective is to understand and evaluate the system. The experimental testbed should be designed to test and evaluate the system in real-time scenarios. Moving on to the methodology, the electronic cardiogram data anonymization is a critical process that involves removing or obscuring personal information from ECG data to protect the privacy of patients, and the below diagram represents the steps followed in it. The EHR is followed by using the following steps. First step is data collection. The first step in the ECG data anonymization approach is to collect the data. This includes obtaining ECG signals from patient and associated patient information such as name, address, phone number, date of birth, etc. Data pre-processing. In this step, the ECG signals are pre-processed to remove any noise signals. This ensures that the data is clean and ready for further processing. Anonymization. The anonymization step involves removing or obscuring any identifying information from the ECG data. This includes removing patient name, address, phone numbers, and other identifying information. Data verification. Once the anonymization process is complete, the data is verified to ensure that all identifying information has been removed or obscured. This step helps to ensure that the data is anonymous and cannot be traced back to any specific patient. Data analysis. This involves using the anonymized data for research or other purposes while ensuring that patient privacy is maintained. This is an example for EHR using ECG. The, the block diagram represents how ECG is performed. The components used are ECG electrodes. These are placed on the skin at specific locations to detect the electrical activity of the heart. Usually one electrode is placed on the right arm, one on the left arm, and one on the left leg. ECG amplifier. The electrical signals picked up by the electrodes are very small, so they need to be amplified. The ECG amplifier amplifies the signals and removes any noise. Signal conditioning. The signal conditioning block removes the unwanted signals and prepares the signal for analog to digital converter. Analog to digital converter. The analog signal from the amplifier is converted to digital signal by the ADC. Digital signal processing. The digital signal processing block performs filtering, baseline removal, and a feature extraction on the digital signal. ECG display or storage. The final step is to either display the ECG on a monitor or to store it for later analysis. Moving on to the result. Evaluation of the proposed algorithm for securing ECG data both in transmission and storing in the cloud database. The algorithm processing time to that of the existing methods that perform a comparable function such as wavelet, packet based, and FFT based algorithm as shown in the figure. The experimental testbed is a real-time scenario that is performed as shown in the figure. The experimental testbed development of the proposed scheme, the ECG data from an observed person were captured using three electrodes ECG sensor that was directly connected to an integrated single-led ECG signal conditioning module. We measured average processing time for the anonymization and reconstruction algorithms independently to acquire clear figure of the algorithm time response in a real-time environment. Applications of the project. Healthcare providers. They can securely and effectively store, manage, and distribute patient data using the proposed system. Patients. Patients can access their health records, make appointments, and communicate with their medical professionals through the system. Health information exchange can be utilized to improve care coordination and continuity for facilitating the transmission of health information between healthcare professionals, patients, and other stakeholders. Public health agencies. Public health organizations can utilize the system to track and monitor disease outbreaks, identify high risk populations, and carry out focused interventions. Now, I'm concluding my paper. Cloud based EHR established a non cryptographic approach to preserve ECG data confidentiality and integrity in the EHR environment. Proposed algorithm has been shown to perform well to preserve confidentiality of patients' cardiac information during transmission of ECG data and to protect information storing in cloud database. In order to prove the integrity of the reconstructed ECG data, we have evaluated both the original and the reconstructed data in terms of cross correlation. Based on the evaluation, it can be concluded that the proposed scheme offers a secure and robust model for protecting patients' privacy in both transmission and storing patients' clinical data in the cloud. These are the references I have taken. Thank you.